Hello, everyone. Welcome. This is Susan Lopresti. Thank you so much for joining me here today. It's February and it's American Heart Month. It's a time when the nation spotlights heart disease, the number one killer of Americans. President Lyndon B. Johnson, among the millions of people in the country who had heart attacks, issued the first proclamation in 1964. I thought it would be a great time to talk about heart health because February is American Heart Month, and in light of Lisa Marie Presley passing suddenly from cardiac arrest at the young age of 54, I thought it would be fitting to talk about heart disease as a topic. As of today, of this recording, which is January 17, 2023, the only thing that we know so far about Lisa Marie's passing is that she went into cardiac arrest. They are still waiting on an autopsy and a toxicology report, and I just heard on one of the news channels that they're not even sure that they'll ever disclose anything of the autopsy and toxicology reports. So, like many others who watched the Golden Globes 2 days before, people are saying that they thought that she didn't look right. She looked tired to me. Her eyes were a little bit heavy, but she spoke beautifully. So, I really wasn't sure if she was maybe a little bit buzzed with a couple of cocktails, or maybe she smoked pot. Who knows? I just know that she didn't look like herself. She looked tired. She looked out of sorts. And she also asked to hold on to the gentleman that she was standing next to when she was being interviewed. My thoughts automatically go to, was there drugs involved or alcohol involved or a mixture of both? And according to some news reports, we may never actually get the full autopsy and toxicology reports. I do want to mention that I am not a professional doctor, and this podcast is for information only. If ever you don't feel well, you should always be sure to consult with a qualified physician. Hello and welcome. This is Susan Lopresti, and I want to thank you for being here with me today. To kick off our event today, it's important that we're all on the same page when it comes to understanding what is heart disease. According to the medical news today, heart disease is the leading cause of death for both men and women in the U.S., and it's the leading cause of death worldwide. Heart disease is a term used to describe several conditions, many of which are related to plaque buildup in the walls of the arteries. As that plaque builds up, the arteries narrow, and this makes it more difficult for blood to flow and creates a risk for a heart attack or stroke. Now, we're all clear on that. You may be asking yourself, how does this relate to you? So let's move on to discuss who is at higher risk for heart disease. Do you know if your heart is safe? When you look at heart disease, it's important to know some of the leading causes to best understand how to reduce your risk. According to the American Heart Association, the following factors greatly increase the risk of heart disease: smoking tobacco, high blood pressure, high cholesterol, physical inactivity, obesity, hereditary, and also unmanaged diabetes. This list of risk factors may seem overwhelming, but the good news is that numerous studies have offered solutions to lower your risk profile by manageable lifestyle and diet changes. Even if you are predisposed to heart disease, don't worry. I'm going to discuss some of the natural ways to reduce your risk. How do you reduce your risk? I'm sure everyone is asking that question right now. The Food and Drug Administration has the following list on their website for some general lifestyle changes that you can make to reduce the threat of heart disease. Quit or don't start smoking. Exercise regularly, maintain a healthy weight, and eat a heart healthy diet. FDA cardiologist Shari Targum explains this as, for example, you can eat fruits and vegetables with each meal and limit saturated fat and added sugars. If you choose to eat meats, choose the leanest cuts available and prepare them in ways that are healthy. If you smoke or are considering starting, please contact a health professional to discuss all health risks associated with smoking, including cancer and possible death. Additionally, smokefree.gov has some really great resources for quitting. So let's dive in right now and discuss diet, as eating a healthy diet is one of the leading ways to reduce your risk. So, healthy diet, healthy heart. To think we can treat heart disease by lowering cholesterol, lowering blood pressure, and lowering blood sugar with medication alone is like mopping up the floor while you leave the faucet running and the sink is overflowing. And that comes from Dr. Mark Hyman. He's a wonderful MD that I absolutely follow, and I've read his books, and I just absolutely adore his whole philosophy on health. This clever analogy from Dr. Hyman highlights the need to discover the outlying causes that put you at risk for heart disease rather than just treating the symptoms with medication. Diet is high on this list. A clean diet, such as the following created by the American Heart Association, is a guideline for getting started on your path to optimal health. And it includes a variety of fruits and vegetables, whole grains, low-fat dairy products, skinless poultry and fish, nuts and legumes, and non-tropical vegetable oils. This, however, is just the general guidelines, and it's not relevant to everyone. You should speak with your physician about your individual nutritional needs, and he or she may suggest that you work with either a nutritionist or a health coach to help you get started on this new diet. Let's look at what's on the menu. Here's a list of some foods that fit within the guidelines of the recommendations given by the American Heart Association that I found at Prevention Online. Wild salmon, sardines, nuts, liver, chia seeds, oatmeal, blueberries, green tea, soy milk, dark chocolate, raisins, yams, whole grains, apples, Brussels sprouts, oranges, avocados, and yep, you've heard this right, red wine as well. So those are the foods that you can eat. So now that you have an idea of what we should be feeding our heart, according to Time magazine, these are the worst foods for your heart health. Fast food burgers, deep fried foods, candy, soft drinks, and sugar-sweetened juices, sugary cereals, cookies and pastries, margarine, meat lovers pizza, diet soda. So basically, processed food is not going to be on the heart healthy list of foods to eat. Many naturopathic doctors believe that the cause of heart disease is inflammation, and the foods above are foods that cause inflammation in the body, whether the result is high blood pressure, high cholesterol, or diabetes. I have pulled together some wonderful heart-healthy recipes to inspire clean eating. There are a lot of options for breakfast, both savory and sweet, so whatever you're craving, there are plenty of heart-healthy recipes for you to get started. And I'm going to put a whole bunch of resources in the show notes, and you'll be able to go back and look at some recipes and ideas and just wonderful tips and tools for a heart-healthy diet. Let's look at lunch. For many of us, lunch is a quick on the go meal, and we often find ourselves reaching for unhealthy options to satisfy our hunger. In an effort to protect your heart, it's important to plan ahead for lunchtime meals so that you can be sure that you're eating heart healthy for every meal. And here are a few ideas that I will also give you in the notes for heart healthy options for lunch. For many of us, lunch is a quick on the go meal. Now let's look at dinner. Dinner is a very important meal. It's a time to sit down and decompress from your day. It should also be a time to nourish our tired, work worn bodies. Preparing dinner does not have to take hours, and to demonstrate that, I'm going to list a few recipes from Eating Well to help you to get started with some simple, healthy meals. Thankfully, so many people have made the move to healthy eating because there are countless healthy recipes out there to soothe that sweet tooth without all the added sugar. Your taste buds and your heart will thank you. And I'm going to also leave you with some very yummy suggestions for some heart healthy treats as well. Plan for healthy snacking. It is very important when you're trying to change your eating habits, especially for healthier food, to always be prepared for those snack cravings that we all get. Without something that you have ready for those midday or after exercise cravings, it is easy to fall off track for something packaged and quick. And again, I'm going to list some really healthy options that you can choose when you're having some of those cravings. So there's a lot of resources that I'm putting in the notes today. Now we want to talk about get moving for your heart. Exercise should always be a part of a healthy lifestyle. But if you are wanting to target a healthy heart, there are some specific exercises that are recommended for reducing your risk of heart disease. Strength and resistance training. The American Heart Association recommends strength training exercises at least twice weekly. This can include push-ups, squats, sit-ups, and jumping jacks. This type of exercise is great for strengthening bones, muscles, and connective tissues, which lowers the risk of bodily injury. Also, by increasing your body's muscle mass, you are increasing the amount of calories the body burns, thus maintaining a healthy heart. Walking and running. Walking is a low impact exercise that is easy to start and then build up to more sustained movements like jogging or running if you feel that you're capable of doing that. Walking is great alone. It's a great way to lower blood pressure and cholesterol while increasing energy and preventing weight gain. Yoga is a great exercise with proven mental and physical benefits. Not only does it tone muscles, but it also helps to reduce stress, lower blood pressure, increase lung capacity, and blood circulation, all while giving you an overall sense of well-being, all things good for your heart. Check out these heart-healthy specific poses that I'm going to post in the show notes. And then we want to start debunking the myths. Most of us have heard some information surrounding heart disease. And of course, there are always naysayers or just questions that surface when considering our health and the accompanying recommendations. We want to look at a few commonly believed myths and discuss why they are not credible. This is one we hear often. Heart disease is something only older people should worry about. False. According to the Mayo Clinic, all of us should take heart disease seriously. There are risks even for younger people based on family history and lifestyle. The myth of reversal. If I'm a longtime smoker, I cannot reverse the damage I've caused to my heart or reduce my risk of heart disease. False. Harvard Medical School states that quitting smoking has immediate benefits, no matter how old you are or how long you've been smoking, and those benefits start the moment that you quit. After just 1 year of not smoking, your risk of heart disease reduces by 50%. After 10 years, the risk drops to that of a person who never smoked. As mentioned before, contact a medical professional for the tools that you need to help you to quit. You can quit today. Now let's look at the risks of genetics. And I'm only at risk for heart disease if it runs in my family. False. Genetics can play a role in developing heart disease, but 90% of heart disease cases are the result of lifestyle. This includes smoking, poor diet, and lack of exercise. It is often these lifestyle choices that can raise the level of cholesterol and other harmful fats in your blood, which can increase your blood pressure and cause type 2 diabetes, both risk factors for heart disease. As Dr. Hyman was quoted before, the lifestyle changes we have highlighted here today can even reduce the risk for heart disease when it comes to hereditary risk. The myth of shortcuts. I can just take an aspirin a day to stave off any heart trouble, including heart attack and stroke. False. Aspirin has been known to reduce the risk of heart-related complications, but every person is different. So before implementing aspirin dosing, it's very important to contact a health professional to first determine if aspirin treatment is right for you, and if it is, what amount would be safe and effective for you to be taking. The FDA recommends informing your healthcare provider of all medicines and supplements that you take if you're considering taking aspirin. Your risk of bleeding may be higher if you use aspirin while also taking certain medicines, vitamins, or herbs. Stocking your heart-healthy spice cabinet, according to the Cleveland Clinic, says that the following herbs and spices are great heart-healthy ways to add some flavor to your meals. Allspice, basil, bay leaves, black pepper, caraway seeds, cayenne and chili powder, Chinese five-spice, cinnamon, cloves, coriander, cumin, and curry powder, dill, garlic powder, ground ginger, Italian seasoning, and mint, nutmeg, onion powder, oregano, paprika, and parsley, red pepper flakes, rosemary, and reduced sodium soy sauce all help to maintain a healthy heart. Now we need to talk about turmeric. Turmeric is considered a great alternative to aspirin due to its naturally occurring anti-inflammatory properties. It is the active chemical in turmeric called curcumin that is responsible for reducing inflammation. Curcumin, according to Curcumin for Health Online, is a great option without the potentially life-threatening side effects of certain medications. Curcumin is known to reduce the spread of inflammation safely. You can incorporate curcumin into your diet by adding turmeric to many recipes, including soups, dressings, curries, teas, juices, and smoothie. And I will put a link for golden milk turmeric tea that I think you will absolutely love, and it's wonderful for heart health. We covered a lot of information, and you may be feeling a little bit overwhelmed, but you've got this. You came for a reason, to make more informed, healthier decisions when it comes to the health of your heart. You are on your way to making a difference in your life. And my hope is that the tools that I provided to you today are just what you need to get started. If at any time you feel a little overwhelmed and you're not sure where to go, please go to my website, www.susanlopresti.com. From there, you can schedule a free 30-minute health coaching session with me to get you started on your way to improving your heart health. So take a moment for some self-reflection. What daily actions can you commit to now to ensure that you will be supporting your best heart health? Again, you could go to my website, www.susanlopresti.com, to learn more about me, what I do, and how I can help you. Thank you so much for joining me here today. I so appreciate you. And please, if you found this to be interesting and think that it could help anyone that you may know, please share it out with them, to your friends and your family. And also kindly leave me a review. By doing that, I will be able to be visible to more people so that I can be helping others to stay proactive in living a long, happy, healthy, productive life for many years to come. Have a beautiful day, everyone.